Hello! In this video, I want to tell you about how body receives the drug. First, we should know what receptors are. They are chemical structures which are composed of a protein. They are inside or on the surface of the cell. They bind to a specific substance. They cause a specific effect in the cell, and they receive and transduce signals. Let's see what receptors bind to. A ligand binds to a receptor. A ligand is a substance that forms a complex with a receptor to serve a biological purpose. Also, a ligand is a chemical messenger to make a signal. So, a receptor with a ligand makes a complex. So, when our body receives a drug, it binds to a receptor and make a drug-receptor complex. And finally, it is turned to a response. Do you know how ligands affect receptors? They either activate the receptor and cause an action, or block the receptor and stop the action. When a ligand activates the receptor, it is called as agonist. So, the drug activates the receptor and produce a functional response. Means our agonist drug binds to a receptor and turn our state on to make a biological response, like morphine that activates opioid receptors. Those drugs which block receptors are called as antagonists. An antagonist drug stops the receptor from producing a response. So, when an antagonist medicine binds to a receptor, it turns the state off and causes no biological response, like propranolol that blocks beta receptors. So, what is the difference between agonist and antagonist? An agonist drug turns the state on and make a biological response, while an antagonist drug turns the state off and makes no biological response. And finally, we have some terms for agonist and antagonist drugs: full, partial, inverse, irreversible, and selective, which we will discuss in our next video.